Assalamu alaikum and welcome back to Hello Doctor. We're glad that you've joined us after the break. I'm your host, Dr. Saheel Mahmud, and I'm joined by a very special guest, Mr. Anurag Jain, who is a consultant ENT surgeon. So, Mr. Jain, before the break, we were talking a little bit about thyroid issues and vertigo. Just going back to thyroid issues, we were discussing the sort of symptoms that you might feel, the fast heart rate, the sweatiness, maybe loss of weight. Are there any other ways that we can tell if they've got perhaps a thyroid issue?
Yes, absolutely. And the most common way it usually presents or patient presented to my clinic is they feel a lump in their neck.
Okay.
And it's much more common than we think. If you scan 100 female randomly, 100 women randomly, up to 60 or 70 will have some kind of thyroid lump.
Wow, okay, that's quite a large number.
Absolutely, and quite often they are not even aware, and these are called as incidentalomas or incidental finding of lump in the thyroid. Fortunately, vast majority are not cancers, but I do a urgent to equate cancer clinic at Queen's Hospital where we get a lot of referrals from the GP, and there are national guidelines we follow to manage these lumps. Start them with an ultrasound scan, which tells us a bit about the nature of the lump. If they look a bit suspicious, they will take a biopsy from it, like a needle biopsy, and pathologists will tell us a bit about what sort of cells there are, and based on that, we discuss that in our weekly thyroid MDT, and then decide further management. If there is suspicion of cancer, this is very likely they will need some kind of thyroid surgery as decided by MDT. Even if it is benign, sometimes it grows very slowly over the years and might become of a size where it starts causing pressure symptom to the patient, like difficulty in swallowing. Some people just don't like a big lump in their neck and want it out, which is a fair indication for thyroid surgery.
And at what point if a patient was to find a lump in their neck, they should just present to the GP? That would be the safer thing to do. Would that be correct?
Absolutely, because just by a lump in the neck, even I can't tell whether it's suspicious or not. You need a scan for that. And quite often GP will organize the scan before referring the patients to us.
And what's the prognosis like if someone was to have any sort of malignant or cancer cells in their thyroid?
Fortunately, a vast majority of thyroid lumps, even if they are suspicious of cancer, a vast majority or commonly occurring thyroid cancer are termed as a well-differentiated thyroid cancer, which in simple term means that they're not as aggressive of some of the other cancers we know, and they overall have very good prognosis. And after thyroid surgery, they live a normal life. Obviously, if you're taking whole of the thyroid gland out, the patient will take a thyroid tablet for life. But vast majority have very good prognosis.
I think we have another caller on the line. So if we can just get the caller to introduce yourself and tell us where you're from and then ask your question.
Hi, my name's Khadija. And I recently started swimming, and unfortunately got what I suspect is sinusitis. But I just wanted to ask a bit more about it in swimming, because it's very off-putting at the moment. So I've got like a blocked nose and blocked ears, watery eyes, and it's just really pushing me off like swimming because I hear it's quite like common and stuff, and I don't know how to like avoid it because I don't want to stop my swimming lessons.
Okay, thank you very much for that question. So, Mr. Jain, Khadija is having a problem with sinusitis. She described her symptoms. What can be done? And obviously, she seems quite the avid swimmer. So, what can be done?
Hi, Khadija. Good evening. Have you had problems with sinusitis for a long time, or is this a new symptom?
This is new. So I only picked it up last week, and it's only like my second time kind of swimming, and I'm like, is this going to be a regular problem?
Okay, and it always follow your swimming, is that right?
So it's my first time getting it, so I just assumed it was symptoms of sinusitis.
Okay, it is possible in that case that you might be sensitive to the chlorine in swimming pool water. Just reflect on it a bit more. I would advise you to start something called as nasal rinse. This nasal rinse is a generic, it's actually a yoga technique which was described by sages thousands of years ago, but some companies patented this technology. This is the nasal rinse. All you're doing is washing your nose with salt, water, and bicarbonate of soda. It is freely available over any chemist. I would advise you to start using this, and you can start using a simple steroid nasal spray, which is also available over the counter, which will not only wash out any discharge you might have, it will also help to reduce any inflammation in the nose, which might potentially have been caused by the chlorine. But be a bit more aware of what makes it worse. It could be the chlorine.
Thank you.
Okay, well, hopefully that answers your question, Khadija, and hopefully you can get back to swimming as soon as you're fit and healthy. So let's continue with our line of questioning. We've covered thyroid, and we were talking about vertigo. You described it as feeling as if the room is spinning. So what are some of the common causes of vertigo?
Absolutely, and as I mentioned that it can be caused by a wide variety of non-ENT related conditions like heart problems. If you basically, it's a balance is a complex process whereby our brain gets input from your eyes, from your receptors in your joints, from your spine, and from cerebellum, and that's how it balances it. If you are having a new glasses or if your vision is not very good, you might potentially have vertigo. Quite commonly we see recurrent bouts of momentary vertigo where a patient, when they turn their head or bend over or they are dizzy in certain position, and this dizziness lasts for a few seconds and only are triggered off when they turn over their head or turn over in bed or bend over, and then goes away. It is there is often but not always a history of trauma, and this condition is technically called as benign positional paroxysmal vertigo. There are exercises described which can cure it. Essentially, basically, in your balance organ deep inside your ear, which is sort of series of tubes with some fluid, there's some crystals that get loose. So every time you move your head, they irritates your balance organ, makes you dizzy. And you can do a maneuver called Apley's maneuver in clinic, using the gravity to get the crystals out of the tube. And there's some exercises called Brand-Daroff exercises, which is described to help patients treat it by themselves at home.
Okay. So if you're having these short bouts of dizziness, then see your GP, do the maneuver, and then continue the exercises at home.
Absolutely.
So that's one cause of vertigo. Are there any other causes of vertigo?
Yes, it's a big topic, and there are a lot of causes. In elderly population especially, there can be a lot of non-ENT causes, including their spine, their joints, input from that. And there is something called as your arteries get blocked with and get narrow, and that can cause something called as reduce the blood flow to the brain, especially when they turn their head with some spine pushing on it, and that can cause vertigo. In ENT, there are other causes like Meniere's disease. There can be other causes, but yeah, it requires a appointment and further investigation to rule anything out, basically.
Okay, great. So let's move on to another ENT topic. So the term tinnitus, what exactly does it mean, and should we be worried about it?
So tinnitus is a very common symptom which is often seen in patients. In simple terms, it means ringing or buzzing in the ears. It can be present in one ear or both ears. It can be caused by something as simple as wax in the ear or fluid behind the eardrum or glue ear or a bit of vacuum behind the eardrum. It can also be stress related. There is a wide spectrum of which patients who suffer from tinnitus. At one of the end of the spectrum is mild tinnitus. It comes maybe with wax or bit fluid, it goes away, they are okay, they carry on with the job. At other end of the spectrum, it is quite loud, the patient can't sleep at night, and it can cause significant distress. In very severe persistent cases, patient might even be suicidal, or it can be quite distress and it becomes an emergency then. So yeah, there are various causes of tinnitus. And
you would just treat the cause for the tinnitus? So it's not one sort of blanket fits all, unfortunately, it's just treating the cause?
Absolutely. They need a complete examination to rule out and treat any obvious cause if there is any. If there is tinnitus in one ear and nothing else is found, they will need an MRI scan of the brain
Okay.
as a protocol to rule out. Sometimes there's small lumps or tumors in the hearing nerves which can cause this.
Sure. Okay. So that's the absolute worst scenario. If there's a tumor that could be impinging and causing ringing of the ear.
Yeah, and it's quite rare, for viewers. Don't get it's MRI scan is just to rule anything out rather than to pick anything. One thing about people who suffer from tinnitus is there is some information on the net as well. If it is disturbing you at night, there are techniques you can use. It's called as tinnitus masking. In simple terms, you're listening to something more pleasant at night, which could range from some natural music like sea music or birds. There are some CDs available, which doesn't quite take the tinnitus away, but distracts your mind, help you sleep. And once you sleep, it's off already.
Okay.
So this is the tinnitus masking techniques you can use to help you sleep. And it can be stress related as well. So imagine if someone is having intrusive tinnitus at night, and then they can't sleep, that stresses them further. Tinnitus makes worse. They further can't sleep. So they have to get out of this vicious circle.
So we've just got another caller on the line, so we'll take the call. So caller, if you could do the same, just introduce yourself, where are you calling from, and what's your question for today?
Hello.
Hi, you're live on the studio. If you could introduce yourself and ask your question, that would be great.
Hello. Yeah, my name is Uddin. Actually, I'm calling from London.
Great.
I have a question. It's like my son is 14 years old, and he is sometimes his nose bleed without any reason, and it happening like 7-8 years, and after a few minutes it's gone off. And we discussed several times with the doctors, but doctors never give us like any kind of solution. So just I need to know like why it's happening and what is the real solution.
Thank you. Good evening, Ujjain. Thank you for your question. I'm presuming your GP have examined your son and they couldn't find any blood vessels or anything. Is that right? Hello, Ujjain.
Mr. Uddin, if you can hear us, the question was, were there any blood vessels found when the doctor examined? We might have lost that call. We have another caller on the line, so we'll come back to Mr. Uddin's question. We'll take this question first. New caller, can I get you to introduce yourself and where are you calling from?
Hello.
Hi.
Oh, okay. Hi. My name is Fahima, and I just wanted to ask, when I was younger, I had a grommet fitted in my ear, and now that I'm 16, I still have liquid coming out my ear, and I don't know what to do.
Okay. So we have Fahima who has a grommet fitted in her ear and she still has liquid and she's a bit confused on what to do.
Okay. Hi, good evening, Fahima. When you say you have liquid coming out, you mean your ears are discharging fluid. Is that right?
Yes.
Okay. Is that clear fluid or pussy fluid?
It's clear.
Okay. I would strongly advise you to get your GP to refer you to an ENT specialist to see. By the sound of it, it appears following the extrusion of the grommet, that was you were left with perhaps a hole in your eardrum, which might need looking at and see if it requires any surgical intervention to patch the eardrum. So I'll advise you to, get yourself referred to see an ENT specialist.
Hopefully that answers your question, Fahima. Was there anything else that you wanted to know from our specialist?
No.
Perfect. Well, that's good to hear. I think we have one more caller, is that correct? We have one more caller and then we'll go back to the nosebleeds. We haven't forgot, Mr. Uddin. So next caller, if you could introduce yourself and the question that you want to ask our specialist.
Hello.
Hi.
Hello, Dr. Saheel. How are you?
I'm good, thank you. If you could introduce yourself and...
This is Humayun Uncle from Croydon.
Thank you for calling in, Uncle. How are you? How's everything going?
You look very beautiful and your presentation is very good.
Thank you very much.
Very impressed.
Thank you very much.
Yeah. I have one question.
Yes, go for it.
So a few years ago, I had a problem with my right eardrum.
Mm-hmm.
Yeah?
So my GP sent me to the hospital, and they fixed my eardrum.
Yeah.
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 And now summertime is okay, but in the winter time, I sometimes it's problem. I got a big pain on my right ear. Yeah. And when I fly in the airplane, when the landing time, I had a big pain on my ear, on the right ear.
Okay.
So at the moment after Corona, we cannot see our GP that much like before. So do you have any suggestion? What can I do?
Yeah. Since COVID, it's become a lot harder to see a face-to-face GP. Often we get telephone consultation. Exactly.
Absolutely.
So Uncle's described a condition where it seems that his ear pain gets worse in winter and on the plane. So what can be done?
Yes. Hi. May I just ask when your eardrum was fixed? I presume you had a perforated eardrum and an operation was done to patch it. Did the doctor said the operation was successful and the perforation was closed? Was it?
If the viewer could just turn down his TV volume just a tiny bit, we're getting some feedback in the studio.
Yes, operation was successful.
Okay.
It was, I believe, 10 years ago, 10 or 11 years ago.
Okay. So, yes, this is a very common issue with a lot of people face. When you go on a plane, taking off is never a problem. It's always descending, which is a problem. And the reason for that is the air pressure caused behind the eardrum, which is a air-filled space, and it's connected with that tube called eustachian tube to the back of the nose. Now, the dynamics of the tube and the anatomy of the tube is such that when you're coming down, the soft bit gets squashed, and until unless you swallow or pinch your nose and blow hard to equalize the pressure, it may not open up. And or let's say if you're suffering from cough and cold, the tube might get inflamed, swollen, and blocked. If it is blocked, and if the pressure is not equalized, you might end up with a painful ear. So all I would say is, as soon as the captain announces they are about to descend, suck some sweets. Anatomically, if you are swallowing, then the tube should open up naturally. If it doesn't because you have a cough and cold, then you try and equalize the pressure by pinching your nose and blowing hard like that to with a view to throw some air down the tube, and that's the best you can do really.
And would there be a reason for symptoms getting worse in the winter as opposed to the summer?
Yes, that's again very interesting point, and that's why I asked. Let's say if you have a perforated eardrum, which is there. In cold air, you have to remember that normally if you go out in winters, your middle ear, that is area behind the eardrum, is protected by the eardrum. But if there is a perforation, cold air can cause severe pain in the middle ear because it's now exposed to the atmosphere. And I get that a lot from my patients who have perforated eardrum, in which case I advise them to protect their ear either with an ear muff or with a muffler to cover their ears.
Okay. So a simple trick to help that pain. Okay, great. Let's go back to our first caller's question. Mr. Uddin had a question about nosebleeds. His son has recurrent nosebleeds for 7 years. What can be done about that?
Absolutely, and I'm glad you asked this question. This is very, very important. Your son is 14 years old and his nose has bled for a long time. I would recommend an ENT review to see, number one, if there's any blood vessels in the either side of the nasal septum, which is the wall which separates right from the left nostril. If there are any blood vessels, that's easy to fix in the clinic by sealing it with a chemical cautery called silver nitrate cautery. Because he's a teenager and he's bled for so long, I would also like to do a nasal endoscopic examination to rule out any masses or any polyps further back in the nose which might be bleeding. So I would recommend you see your GP to get him referred to ENT specialist.
Perfect. We're rapidly running out of time. I've been told we've only got 3 minutes left, so time has been flying past. I think what would be very beneficial for our viewers is if you give us maybe top tips to maintain good ENT, so ear, nose and throat health, and how to deal with maybe a couple of tips on how to deal with the common conditions of ENT.
Absolutely. All I would say, as I mentioned, I always advise a patient against using cotton buds, especially in Southeast Asian communities. Of food, you know, we like to eat a curry or spicy food or fried food, and I certainly enjoy a meal out in the night. But it is rich in spices. It can also give us acid reflux and heartburns, and obviously, if you get that, that can not only cause problem with the stomach, but also in the throat. We have to remember, and more commonly is the silent reflux, which is laryngopharyngeal reflux, which can cause more throat symptoms. So it's not recognized as acid reflux because it doesn't give you any heartburn. So to be aware of that, obviously, yeah, drink more water. I think in cold weather we tend to forget how much important it is to drink more water. That's good for your sinuses, general health. Also helpful in acid.
Perfect. So again, thank you very much, Mr. Jain, for joining us today.
Thank you.
It was a pleasure to have you. Unfortunately, that's all we have time for today. There were a lot of topics that we wanted to cover. We didn't get to cover all of them, but hopefully the topics that we did cover help, and you've learnt a little bit about ENT health. Please do join us next time for our next episode of Hello Doctor. From your host, Assalamu alaikum wa rahmatullahi wa barakatuh.